I'm Sabi. I'm a BCBA here at Success on the Spectrum in Houston, Texas. So I am a clinical director here. I oversee the programs, I oversee the clients, and the other BCBAs here at Success on the Spectrum. About 15 years ago, a friend of mine had told me that there was a position for something called an ABA therapist at a small clinic in Houston, Texas. And being the person that I wanted to make a difference in a child's life, and I decided to try out for this position. And I became an ABA therapist, and 15 years later, here I am, a BCBA. This is a really fun job. I get to come in, see all these people that I truly love, both my staff and my clients, and getting that good morning hug from all the kids and seeing their progress, and just being with the team that really truly enjoy being here, and all of us enjoy each other's company. So it's a fun job. We have to enjoy it, right? My personal reasons for wanting to be a BCBA is really to see the progress. It gives me this inner joy that I can't really explain, to be able to see a child that, for example, was not talking before, but now all of a sudden they're talking, or a child that communicated with their needs through maladaptive behaviors, but now they're actually using functional language to let us know what they need so that they don't have to engage in those behaviors. A lot of times I come across parents who are hesitant to enroll their child in an ABA program. And when they come in, I tell them that, try it out. Just because they're not in school does not mean they're not going to get the education that you want for them. ABA is not a one-size-shoe-size-fits-all. Every child has different behaviors, every child has different needs. So the way to really figure out where they need to go is by doing an assessment. And that helps the BCBA determine where they lack as far as skill acquisition goes and where they are doing well. So we know that, okay, we're not going to keep repeating stuff that they know well, but use that to help them get to where they need to be. The beautiful thing about ABA is it does not only just have to be catered to the four walls within a clinic. The parent can continue to practice ABA strategies even after the child has already been enrolled in school. And we understand that as BCBAs, we understand that the parents have goals for their children, and it's the best interest in the child for them, the parents and the clinician, to be able to work together to come up with a solution. The most challenging part about being a BCBA is sometimes finding the right program for that child, or you're in a situation where you're not exactly sure which is the best way to go, and doing research and just hoping for the best. My journey into becoming a BCBA has taught me to have perseverance. That exam that we take to become a BCBA is the hardest exam ever. But you know that by taking it and passing it, you have an end goal. And so the journey is just continuous growth. Just keep at it. There are days that will be difficult, and there are days that will be easier. But if you just keep the greater picture of keeping the client's best interest at heart, then you will get through whatever you need to get through. If I am being effective, I look at data. And then I also look at the child. Sometimes the data might not be able to show exactly what the child is able to do, but then history shows you, that child's history shows you that they have, gained a skill. For example, a child that has previously always been in diapers or pull-ups, and all of a sudden they're toilet trained and they're asking to go to the bathroom. That right there shows you that their skill that you're teaching them has been working with the strategy that you have implemented. Success on the Spectrum is unique in the fact that it caters towards all environments. So it helps the child during their social settings, helps them increase those social skills that they don't have and that they may need assistance with. Success on the Spectrum also does field trips as well as community outreach. We're providing monthly parent training workshops. Generalization is super important in a child's life. We want them to be able to take a skill that they learn anywhere and be able to utilize that in any environment. Another really unique factor about SOS is that it has a parent viewing room. A parent can come in at any time and watch the child in action. No questions asked. I've actually had parents tell me that they've noticed our technicians doing a strategy with their child that they have never seen before, and they implemented the same strategy at home and saw success. Parent training is actually one of my favorite things about being a BCBA, because these parents, they see their children at home, but they are not able to see the successes in the clinic. So my job as a BCBA is to teach them those skills so they can see that their child is making progress, and for them to feel a sense of pride because they're the ones that are helping them by bringing them here and participating in parent trainings. This job is unlike any other. It is very rewarding, but at the time it has its challenges. And the way to overcome those challenges is to have a strong work ethic. Show up before the client, get the things ready that they need for the day, and then work your hardest. Work on the goals that they need in order to achieve mastery. And then when you leave at the end of the day, take the good with you and leave the bad. Wow, there's so many rewarding experiences at the BCBA that it's really hard to pick just one. Some of the most rewarding experiences is when I get through a session and the child whose session has been previously difficult for me because of any behaviors that they may have exhibited, all of a sudden does not exhibit those behaviors. Or, when a child who has never said the word up before in his life, and all of a sudden he says up because he wants me to pick him up. That's amazing. There's no word to describe that. When you teach them to say something that they've never said before, and you know that it's because of something that you may have done or you may have taught someone else to do, there's nothing to describe it. Indescribable. The main goal at SOS Southwest and SOS in general is to help the child achieve their greatest potential, whether it is school or whether it's not school. We want to help them get to where they have the potential to be. I don't like to say never, right? There's always a glimmer of hope for even the most extreme cases. But for the clients that really struggle with potentially being mainstreamed into what we call a quote-unquote normal society, it's for them to find happiness within themselves and for them to be accepted not just by others, but for them to accept themselves as they are. The children are our biggest teachers. Without them, there wouldn't be this field. I wouldn't have this job if it wasn't for the children. My greatest hope for the clients that I serve is that they are able to be mainstreamed into society, to where their differences are accepted and people can see that they may be different but don't necessarily treat them as they are. At the end of the day, it's about the child, and that's what matters. Not what we want for them, but where they need to be and what they want for themselves.